Did you know that 1 in 4 black men will get prostate cancer in their lifetime compared to 1 in 8 for other men? The exact cause for this is not fully known, but it might be linked to genes. In this short but important video, I'm going to explain some risk factors for developing prostate cancer, what to do if you're a black male over the age of 45, and what might happen when you go to see your doctor. Now, I hope that this video could potentially save yours, a family member's, or a loved one's life, so please do share it widely and leave any comments below to help others. Before we start, let's just briefly take a look at what the prostate is and what potential symptoms of prostate cancer are. So the prostate is a small gland in the pelvis, and it's part of the male reproductive system. It's about the size of a walnut, and it's located between the penis and the bladder and surrounds a tube called the urethra. Now, the main purpose of the prostate is to produce a thick white fluid that creates semen when mixed with the sperm produced by the testicles. In terms of symptoms of potential prostate cancer, you might notice that you're having difficulty starting to pee. You may also have a weak or interrupted flow of urine. You may be urinating more often, especially at night, so you could be getting up at night time to go to the toilet or having trouble emptying your bladder fully. You may also notice pain or burning during urination, blood in your urine or semen, as well as pain in the back, hips or pelvis that doesn't seem to be going away. Now, it's important to keep in mind that these symptoms may be caused by conditions other than prostate cancer, and sometimes prostate cancer doesn't have any symptoms, especially if it's at an early stage. So now we know a little bit more about what the prostate is and what some potential symptoms are, let's discuss risk factors. So we already know that black men are more at risk of getting prostate cancer, but other things that might increase the risk in black males are if you're aged 45 or over, and your risk does increase as you get older, your father or brother has had prostate cancer, or your mother or sister has had breast cancer. Now, just because these might apply to you does not necessarily mean that you have or will develop prostate cancer, but I think it's always good to be aware of the things that could make you at higher risk so you can have an informed discussion with your health provider. So what if you are a black male over the age of 45? What should you do next? Well, if you're black, you have a prostate, and you're over 45, you should speak to your doctor about your risk of prostate cancer. I'd also strongly recommend that you speak to them about having a prostate-specific antigen or PSA test, which is a blood test that can help to diagnose prostate cancer. Now, there are advantages as well as disadvantages to having a PSA test, and it's important that you're aware of these. Now, some of the advantages are that it can help pick up prostate cancer before you have any symptoms. It can also potentially help to pick up a fast-growing cancer at an early stage when treatment could stop it from spreading and causing problems. Now, the PSA test can also be done at intervals to check for any changes. However, it does have some disadvantages. For example, your PSA level might be raised even if you don't have prostate cancer. Many men with a raised PSA level don't have prostate cancer, and PSA can be raised after vigorous exercise, so things like spin cycling, sexual intercourse, or in a non-cancerous condition called benign prostatic hypertrophy, or BPH. The PSA test can also sometimes miss prostate cancer, meaning that it's not 100% accurate. Now, for these reasons, so the pros and cons, you'll need to talk to your doctor or practice nurse about these before deciding whether or not to have the PSA test, and remember to tell them if anyone in your family has ever had prostate or breast cancer. So some people might ask, why would I go to my doctor if I don't have any symptoms? Well, most men with early prostate cancer that has not spread beyond the prostate don't actually have any symptoms, and often symptoms only develop once the cancer has become bigger. But if you do have prostate cancer and it's caught at an early stage before it's causing symptoms, there's a good chance that treatment could stop the cancer from spreading. And whilst it may not be possible to cure your cancer, you may be able to have treatment to help control the cancer as well as manage symptoms. So what's going to happen when you do go to your doctor? Well, typically your doctor is going to ask you questions and examine your prostate through your bottom using a gloved finger covered in jelly to check it for the size, shape and consistency. They'll also have a discussion with you about checking your bloods, so things like the PSA test. Now, it's natural to feel worried or embarrassed about going to the doctor or having tests, but don't let that stop you going to see them. Remember, your doctor is a trained professional who will have seen this many times before, and they're going to be able to give you a good idea as to whether or not you have a problem that needs treatment. If you're not sure about what to say to your doctor, I've included a link from Prostate Cancer UK for a form which you can print out and fill out to show them, and I hope that this will help you have an informed conversation and cover all of the key important points that you need to discuss with them. Finally, what should you do if your doctor won't give you a PSA blood test? Well, here in the UK, if you're a black man over 50, you have the right to a PSA test if you've thought carefully about the advantages and disadvantages. If your doctor doesn't agree to give you a PSA test and you're a black male over the age of 50, you should ask to see another doctor or practice nurse. If you're a black man between 45 and 49 years of age, you're not entitled to a PSA test until you're 50, but because you are at higher risk, many health professionals believe that you should be able to have tests from the age of 45 if you've thought about the advantages and disadvantages. Again, I've included some great resources from Prostate Cancer UK in the description box of this video, which can help guide you through discussions with your health provider to make this process easier for you. In this section, I've also included an electronic leaflet from Prostate Cancer UK, which explains more about prostate cancer and other prostate problems, including things like who's at risk and what changes to look out for. I hope you found this video useful and informative, and please do share it widely with someone who you think could benefit from it. Thanks for watching, and until next time, bye.